is a small but mighty group, and I'm really excited for the conversation that will come out of this today. So welcome and thank you for joining our data-driven advocacy session today. So it's part workshop, part conversation amongst all of us. And again, because it's such a small but mighty group, hopefully we'll have some really good conversation. I'm Celeste. I am a consultant with the National Collaborative, and I am working and moderating our Leveraging Hope group, which I'll tell you a little bit more about today. We see some of those blue ribbons in the crowd today, so we are well represented both on the panel and in the audience. So we know, even after you listen to this morning's panel, approaching the use of data might feel like cracking a complex code in a world filled with a lot of numbers and charts. But really thinking today, what if we leverage data to tell untold but crucial stories in our fights for equity and justice that everyone could really understand? Yeah. As many of you know, NCHE's data advocacy work centers our Health Opportunity and Equity Initiative. So this initiative has 27 indicators that measure items across 5 domains of social and economic factors, community and safety, physical environment, access to health care, and health outcomes. So this data demonstrates how well the 50 states and DC are providing equitable outcomes and opportunities to thrive and achieve good health. Helping amplify and connect this data to change, our Leveraging Hope partners are local change makers who are applying and updating our Hope data resources and providing a new opportunity frame and narrative that really delivers actionable data and information to help our nation move beyond measuring disparities to compelling action to achieve health equity. So that's really where NCHE is really invested in data work. As you know from the session description, we're going to think about the crucial role of timely information and data in achieving advocacy goals and driving meaningful change. So we'll talk about collection and analysis of data that helps amplify advocacy efforts, messages, and make a compelling case for policy change. We have wonderful panelists here who are going to share examples of their own work from their different vantage points to really highlight the power of information and data-driven advocacy strategies. To ground us today, though, I really want us to kind of center on this statement, and I just mentioned it a couple of minutes ago, that data has the power to tell a story that everyone can understand and that really leverages us to make powerful decisions towards equitable futures. Really understanding how powerful and necessary it is to have this information that we have. So we'll ground ourselves in that as we listen to our panelists and get going. But first, I have an energizer for us to wake us up, to get us ready to receive information and get new ideas coming. So you can either stand or stay seated. This group looks like you're trying to save some body warmth. So we can. But stand or stay seated as you want. This is an activity I call looking around. It's going to take 2 minutes. But first, I'm going to give you directions to move your head. So if you are able to, I'm going to give you directions to look left, to look right, to look up, or to look down. All right? And so we'll just do this for a little bit. I'll try not to make you too dizzy, okay? All right, so left, right, down, up, right, down, right, up, left, down, left, down, right, up, down, left, right. All right, not too dizzy. Next, feeling good and relaxed. All right, on this next round, we're going to change things up a little bit. When I say left, I want you to look right. When I say right, I want you to look left. Up and down will remain the same. Okay? All right. Up, down, right, left, down, left, right, up, down, left, right. All right, you guys got it by then. All right, great. All right, so hopefully you're feeling a little relaxed. You can sit down. How was that? How did that feel? It was difficult. What made it difficult?
Brains.
Your brains. What? Yeah. What about that? Yeah, muscle memory. Right.
I think what scared me is I seem to be quicker doing the opposite.
Once, and it asks us to name things differently,
Mm-hmm.
and it's connected to the biases that we have.
Absolutely.
When we hear a certain word.
Thank you. Well, we're done. She did the whole panel, right? But really, it's opening us up and thinking about, right? When we usually hear this word data, we already have these preconceived notions of what it is, what our limitations are, our own experiences maybe in school or even at work when maybe funders are asking for evaluation numbers and all these things that come with thinking about it. And I wanted to show that, sometimes if we just open ourselves up to get maybe a little bit different direction, what that can open us up to doing and to receiving. So that activity was showing just that, like just opening us up to receiving new information about maybe things that we've known in the past. And maybe we're getting new directions and new knowledge about an older notion or something that we know about. So that was that. Feel free to use that in any kind of meeting, get people's necks going and going around. Before we get into our panel, one thing that I want you all to take away, I use this acronym SPUNKY. I use it with 18-year-olds, but it works for us too. But it's thinking about and how to stay in a reflective kind of mode. So as you're thinking and learning and hearing from our participants today, and then even doing our own reflections later, I want you to think about maybe something that is surprising to you that you hear, something that might be puzzling, something that's useful, something that's new to you, something that maybe you knew already, and something you yearn to learn more about. You can pick any one of those things, all 6, but that'll really hopefully help you stay open to receiving what we have today. So now our panelists. All right. Oh, no, you're good. I'm going to go through our bios real quick. The bios are also in your participant booklets as well, but I just want to introduce my awesome friends up here with me today. I'll start with Cassie. So Cassie is an accomplished leader, journalist, and entrepreneur, building strategies and businesses at the intersection of social impact and storytelling. A former Philly city administrator and co-founder of Resolve Philly, which is a renowned nonprofit newsroom fostering collaboration and innovation in journalism, Cassie is currently a Knight Wallace Journalism Fellow in residence at the University of Michigan. Her leadership and strategic approach to maximizing social impact have garnered widespread recognition, making her a respected figure in policy communications and across the nonprofit media landscape. Thank you for being here, Cassie. Next, we have John, who is also part of our Leveraging Hope group. And John has been executive director of the Metropolitan Tenants Organization since 2004. He has a Bachelor of Arts degree with the emphasis in community organizing. He has over 35 years experience in nonprofit administration, organizing, fundraising, and program development, including 30 years of experience in housing. He's an active participant in National Safe and Healthy Homes Coalition and an established leader in the area of tenants' rights. Next, we have Chaya, who is the director of the Child Health and Data Lab, the department within the Child Health Advocacy Institute of Children's National Hospital here in DC. Her work centers on using data to advance racial and social justice issues, particularly in reaching health equity for children. Chaya has significant experience working collaboratively with community-based organizations to facilitate social and health change. She co-directs the community engaged research component of the Clinical and Translational Science Institute at Children's National and co-chairs its community advisory board. In addition, she holds a faculty appointment at GW School of Medicine here in DC as assistant professor of pediatrics. And Patricia is co-executive director of the Chicago Area Fair Housing Alliance, jointly leading the organization's policy and advocacy initiatives. Patricia is the go-to expert on innovative fair housing research, that brings to light long-time disparities in housing based on systemic discrimination. At the core of her work is a passion for building strong partnerships to advance fair housing justice efforts. Patricia previously worked at Lawyers Committee for Better Housing, advocating for tenant rights and conducting original research on and reporting on foreclosure and displacement. Thank you all for being here with us today. So what I wanted to start us off with was posing a question to each of you to answer in really helping us get grounded today. Can you all share an example of how you have or currently use data as a tool for advocacy and change in community? And in that, thinking about maybe what you were trying to achieve when you started, how you decided what the story was based on the information that you had, and then how the data helped drove that work for you.
Oh, sure. So as a journalist, I come at this from a slightly different perspective. Journalism organizations, newsrooms cannot have a direct advocacy position. I work in policy spaces, and so the way that I think about the role of journalism in impacting policy is really the narrative climate that local media in particular contributes to. And so I am excited to share this specific example. At Resolve Philly, which is the newsroom that I co-founded in Philadelphia, we have a reporter on staff. He's an investigative solutions reporter. His name is Steve Volk. He spent the last 5 years reporting exclusively on child welfare and the foster care system in Philadelphia. This never happens. The idea that there would be one reporter whose job it is to just focus on child welfare was first of its kind. And so this is how we start. Steve roots his work in community engagement. The stories that Steve tells come directly from his relationship and the trust that he's worked to build within the foster care community in Philadelphia over a very significant period of time. This isn't a reporter who just kind of hops on a story and goes and follows up with a family, maybe reports on it for a few months. The specific story that I think is a really good example to bring into this conversation, Steve was talking to a gentleman. He had 3 foster sons. And as part of their conversation, Steve wasn't reporting on a specific story. This was just Steve out at an event that was being hosted by a community partner, which is part of his job, right? That should be part of what journalists do, is just show up in places. So Steve is at this event. He's talking to this guy. They have a couple of other conversations. And Steve learns that his 3 foster sons are eligible or should be eligible for Social Security payments from a deceased former adoptive parent, but that they weren't getting that money. And so Steve and Resolve Philly's data journalist, Julie Christie, they spent over a year reporting this story. The story was published in December of 2021, and the story was, and this came from right to know requests. This came from absolutely hounding the city government for this information, right? Because they don't give it out freely. But what we learned was that the city was actually retaining Social Security benefits that foster children are entitled to and putting it back into the general fund. Into the general fund. This is a lawful practice. Our reporting discovered that between 2016 and 2020, about $5 million was diverted away from foster youth and into the city's general fund. In March of 2022, Councilwoman Helen Gim proposed legislation on the floor of Philadelphia City Council that would ban this practice. Maryland actually banned this practice in 2013. There are other jurisdictions across the country that have banned this practice, but unfortunately, it's actually still legal in a lot of communities. So that direct policy impact, she cited Steve and Julie's reporting as the reason for proposing this legislation, which was ultimately passed. As of December 2023, the city is still retaining money, and they admit this. DHS admits that they're still doing this. They have not, in spite of it now being illegal, they have not updated their systems to ensure that these young people are getting the benefits that are entitled to them. So I bring this up because I think that this is a real, clear example of when you go in with an open mind and without a predetermined story that you're looking to tell, right? This is the problem that journalists have. We go in with a really specific objective, the story that we want to tell. But if we are instead more rooted in community, more centered in the work, more responsive and reflective to the needs of communities, what ends up happening is authentic policy change that's really rooted in the needs of communities. So that's the example that I want to.
Great example. Chaya, I'll go to you and then I'll have John. Great. Well, good morning, everyone. It's good to be here. So I'll give you an example of some of the work we're doing at Children's National Hospital right now. But before I do, I just want to mention that the hospital is pretty unique in that it has a institute dedicated towards advocacy, which is pretty unique. It used to be the only pediatric hospital. Maybe not the only anymore, but still it's pretty unique. And that's a part of the hospital that I work for. So I work in the advocacy department and spend part of my time in the research department as well. All nonprofit hospitals in the US, and most hospitals in the US are nonprofit, all of us are required to do a community health needs assessment every 3 years. So this has been something that I've been involved in since around 2012 or so. So I'm on version 5 of these needs assessments. The government's not really prescriptive on how you do the needs assessment. There are hospitals that survey a few people and they call that their needs assessment. I talked to 5 people and this is what they said. And then there are hospitals like ours who take it really seriously and try to use a really informed, data-driven approach to this. And so I lead the needs assessment for Children's National. So for the last assessment that we released in June of 2022, we adopted a tool called the Child Opportunity Index, the COI. So you're familiar with it. It's similar to what Celeste was talking about in terms of the HOPE data, where it's a composite index. It has 44 different indicators that are predictive of a child's opportunity to succeed. So these 44 indicators are broken into 3 domains. But just to give you an idea, they're things like the quality of education in a neighborhood, access to food, employment rates, insurance rates. The important thing to note is that they're non-clinical determinants of opportunity in health. So these are neighborhood features. What is happening in the neighborhood that you live in? Since this is a data group, I'll say we use the term neighborhood and census tract somewhat interchangeably. So when I say neighborhood, we're either talking census block or census tract. So we've been using that tool since 2022. The next needs assessment is due in June of 2025, so next June, this fiscal year. So we're continuing to use that tool now. They just released their most recent version in case anyone's interested in working with it. We're on COI 3.0. The version we used last time was 2.0. So now this version of the COI, the Child Opportunity Index, has 44 different indicators. We went through the whole process. So essentially what the tool does, it runs through this mathematical algorithm to look at 44 indicators for every single census tract in the United States. So there's about 72,000 census tracts or neighborhoods. For every single one, it goes through all 44 indicators and it gives it a numerical score, each neighborhood, between 1 and 100. So 100 is saying that, this environment, this neighborhood is a neighborhood where children are given what they need to succeed. They have access to food, the employment rates are high, there's green space for them to play. There's 44 of these factors. The closer you are to the optimal levels, you're closer to 100. The further you are, you're closer to 1. So you can imagine the types of maps we can produce that show how areas of opportunity closer to 100 are concentrated in certain parts of the city, and areas of low opportunity are very concentrated in other parts of the city. So the hospital and my group used that information to really devise a plan as to which areas in DC, we're in DC, so we're working in DC and parts of Maryland, which areas, which neighborhoods we really want to focus on because they have really low opportunity for children. But maybe even more importantly, because we already knew that information, right? That's one of my pet peeves is when people want to use data to tell the obvious. I'm like, okay, we already know. We don't need to spend all this time looking. We know. But maybe what we didn't know is which of those 44 indicators was pulling down opportunity in specific neighborhoods. And I can't speak to rural areas, but in urban areas, you will have neighboring areas, neighboring neighborhoods that have really good education right here, just a few miles down the street. And then, a few miles down, kids don't have a great place to go to school. The other example is always food. Neighborhoods that happen to have a grocery store where people can walk to them. And, you're just a couple miles down the street and there is no grocery store for you to walk to. So that's what this tool was able to tell us. It was able to really pinpoint, what is actually pulling down opportunity for kids. And then that gave the hospital the opportunity to say, like, this is what we're going to invest in as a hospital. And so that's what the idea is behind the community health needs assessment for hospitals. Not only do you do the assessment, but then the hospital is required to invest in whatever you found, whatever the needs are. So our hospital ended up selecting 4 areas of priority, and they were early childhood education, access to healthy food, health insurance rates, and employment rates. And if there's time later on, I'm happy to tell you about some of the things that we're doing in that area. But one thing I'll note before we turn it over is that we didn't just look at the quantitative data, and I'm sure we'll have conversations about this as we move on. The quantitative data are important. I mean, that's my training of what I've invested my career in, but they really mean very little unless you couple them with qualitative data and the stories that are coming from the neighborhoods and how much life that brings to the quantitative data. So it was definitely a mixed methods type of approach where communities were involved from the very beginning in helping decide what tool we're going to use, how we look at the data, and then really importantly, how we address. Welcome. All right, John.
Well, I always like to look at data as a way of engaging our constituents, actually, because what we do is we listen to the stories of the tenants and all that, and what their problems that they're actually experiencing, and then start turning that into data. Actually, so for instance, we can tell you why tenants call our hotline is mostly because they're having repair problems, but it's also about eviction and retaliation. So I think what to me data is a way for us to start engaging tenants and bringing in so that we can start describing the problems, or actually that the constituents and the people we're representing are telling their story. So it's not necessarily like what happens to all renters in our case. What ours is about what's happening to tenants who are facing insecurity or who are facing substandard rental housing issues and all that. So that's the first thing that I like, is that data is about engaging the folks so that they can tell their story, so that they can go out and when they're talking to their representatives, that they can start saying, well, this is my story and this is happening throughout the city. This is so many other tenants are experiencing the same problem. So I think that's the first thing I like to do, is start thinking when thinking of data. And an example of that, we've been collecting data now on our hotline for 30 years. And it just started out with the basic, well, why did the tenant call and what's their address? And maybe I think we started out with 6 reasons of why or whatever. And then like an example of how we even changed the way we were collecting data is that one year we started, there was a bed bug invasion in Chicago. All of a sudden, we started getting multiple calls from tenants. I'm dealing with bed bugs. What do I do? And it's just like, and all of a sudden, so then we started having to tell tenants like, yeah, well, here's what the law is that doesn't even deal with this, does what to do, and it was inadequate. So then what we did was actually started bringing this to our public officials to say, we have a problem. We went from not having enough calls about bed bugs to even like detail to say that we're now getting 30, we're getting 300 to 400 calls in a year about this, is what it did. So then it forced the public health folks and the housing people to start saying, oh, we have a problem. We need to deal with this because it's not covered in the law. So after, hearing like the problems that tenants were having about bed bugs and how the landlords are trying to say, oh, this is your problem. You're the one that's at fault. It's your thing, that we were able to actually, what I would say, also bring a little bit of science into the data, where the science is that, well, in fact, bed bugs can come from anywhere and they move from apartment to apartment, and that you actually need to actually deal with them in a systemic way in the units. You can't just look at one unit and think, oh, I'll get rid of it in one unit because we've got no although just go to the next one, the next one. So the law actually that resulted from the complaining or the bringing this up was that, in fact, landlords had to then inspect all units. Once there was a bed bug found in one apartment, they had to go and inspect every unit that in any way touched that unit. And they also said that, in fact, that this is a no fault. It's not the landlord's fault. It's not the tenant's fault. We can't put fault on here because that's what kind of the science in that showed. And so they came up with the law that said the tenants are responsible for getting things all ready for the abatement, and the landlord's actually responsible for the abatement, and that they actually have to go and inspect all the units around the apartment, and that they have to then abate every unit that they find bed bugs in. And, you know, this was actually very helpful. I mean, it actually created new policy, new law that didn't necessarily put anybody in effect, but it came from us being able to say, we're collecting this, we're hearing all this information, and it's like we went from unknown, very few calls to all of a sudden, you know, significant number, you know, where we're getting one every 5 call, or one every, not 5, one every 20 calls is about bed bugs. So that caused the law to actually shift. So, you know, that's one way I think that data can be useful, but I think it comes from, you know, this whole thing, once again, of it's giving tenants a space to tell their story.
Right. I'm hearing a theme of like who gets right to tell the story and how we're listening to the stories. Patricia?
Okay, so I have a couple of slides, and as I was thinking about this, and we didn't talk beforehand, but I have so many parallels for what you were saying to kind of tee up the conversation. I think, first of all, for me, data is power. Data is really like the bricks for how we build stories. And storytelling can lead to this powerful narrative shifting that creates the will and the actions for change. But how? Data's everywhere. You just heard, you know, you can have like, I'll call it like kind of a think tank, like a research center. You're looking at different indicators. You probably have like powerful computer systems that like look at this data down to everything to picking up a phone, putting a notch for bed bugs. This person said bed, like that is such different ways to use and collect and analyze data. And it can be super sophisticated and take probably a lot of resources and people power to something that's, sorry, John, but a little less sophisticated, but the outcome is the same. You're changing minds. You are changing policy. That's power. But how do we harness this power? And I think the formula for success is combining community-driven qualitative data with quantitative data to tell a compelling story that really demonstrates and inspires people to see that we have a tangible path to change, and there's something that we can change. We have the power to make a change. Next slide. I'm going to give one example of how we did that at my organization. So on the screen are images from a Just Housing campaign in Cook County. This campaign was built from calls from individuals with arrest and conviction records, indicating that housing bans on people with records were a form of permanent punishment. It harmed individuals, it was harming families, it was harming entire communities in our city and our county. We were finding, just based on kind of these stories and looking more into the issue, that housing providers and public housing authorities were imposing 100-year look-back periods, for example, or outright bans on an arrest alone to simply access housing. So we successfully built a campaign rooted in these stories of really unjust exclusion, and we layered that with data that showed that not only are people of color and people with disabilities more likely to be targeted for their for arrest, they are more likely to have that arrest or conviction used against them when looking for housing. So that was like this really unjust double whammy kind of effect that was just closing doors for folks all over the place. We had fair housing testing that demonstrated that individuals with the same type of background, the same type of arrest or conviction background, and 1 in 3 U.S. adults have some type of background, were treated differently based on their race alone. So kind of armed with that data, rooted in the stories that we heard, And also, you can see here we had a local community artist that helped us like turn these stories into imagery. All of this together allowed us to make a compelling campaign to Cook County, to our elected officials at Cook County, and demonstrate this is one of the most significant civil rights issues of our time. And now we have in Cook County some of the strongest housing protections for folks with records across the country.
Great, thank you all for sharing that. And this can go to our housing partners, either John or Patricia, or you can answer this together. What perspectives about data have changed over the course of your work in advocacy? So I know even John talking about having the hotline and just seeing how powerful it can become from collecting a little bit of data to getting all this nuanced data, and even Patricia, from your example as well. So maybe how have your perspectives in data changed even through your own work?
I guess I have mixed feelings on data and all that, because I mean, part of me starts looking at our current campaign that we're trying to get a proactive inspections for all rental housing, to say that. And this comes from, once again, talking with tenants. Our story, that we are with HUD tenants, and they were talking and saying, well, HUD says they come out and inspect all the time, but really all they do is a sample inspection, and they never inspect my unit. And I have tons of problems, and this happens we hear this story over and over again, and we hear from the tenant, 40% of all the calls that we're getting on the hotline are about substandard conditions. And then we bring in health department data that we've looked at, and we can see that childhood lead poisoning, what is it? It's in the same areas that we're getting our phone calls come about substandard housing, or the children having to go to the hospital for asthma, same places, going over again and once again. Then you combine that a little bit with the science. It says, where's the lead coming from? It's coming from paint dust that's in the homes, that's been there forever, and all this. So we start seeing that we know that that housing is causing people to get sick. We're bringing this actually then to our elected officials, and we're pointing out to them. And what happens is that they always look at the data that we're presenting them, and it's like, yep, that's true, but inspecting all the units, that's just not going to work. And it's it's because it's not going to work because it's going to be too costly, it's going to be too big, or what's it going to do to these? They start listening to the realtors, and who are throwing all this, what I hate to say, but it's fake data. It's not data that has it's lies. Mm-hmm. It's plain out and out lies. And so then it's like, we can't do this. So we're kind of, I feel like, and it's one of the things that I'm not sure how to, I don't have data necessarily to show that they're lying. Because, that becomes an issue. And so I think that's some of the, to me, that's an issue around housing, is that we're having to confront people that have money to put out lies, and that they're kind of distorting and saying, oh, this doesn't matter, or what they're actually saying is that when they ask, well, how is this going to impact the rental market? Instead of they're not asking, how is this impacting our kids? How is this impacting people's health? How is this going to impact the rental market, or it's going to impact the profits? And I think that's really kind of the issue, or some of the things where we need to start looking at data in a different way, is because I think that the data is out there, like these same landlords that are complaining about this. Like, we don't have any real data about, well, how many units do these people own? How many people have they evicted collectively? Because there's probably a few of them that are doing most of the damage, or how many building code violations do they have? How many times have they been to building court? We don't have this data, partly because it's hidden. I mean, it's like our communities, the data is open and you can see the problem, but we can't see the data of the actual ownership of property, because they have all these LLCs out there that well, who is the owner? And you can't see like, oh, this person owns this LLC and this LLC and this and they've actually have evicted all these tenants, or that they have all this bad properties, because it's all hidden. So I think that, to me, there's part of our data that's we're missing. We're fighting with our data and telling our story, but we're missing part of that story of the actual. To me, that the actual problem is that there are these people that are a little, what I would say, over greedy, and that they're
Just a little.
Yeah. That then makes me think of, Cassie's work and thinking about investigative journalism and maybe what the role of investigative journalism could be from these kind of more traditional aspects of data collection and these avenues, that maybe there's a role for journalism in doing that. Any thoughts about?
Yeah. There is a role for journalism for sure. And I think, there's some similar, I think, challenges in terms of, who has access to what data sets. As a journalist, with a law degree and a public health degree, I have a greater understanding of how to access and engage with large data. The average journalist does not. I mean, you have to have like a PhD to be able to query the open data sets in the city of Philadelphia. I have to imagine it's similar in other big cities, and that's a huge problem. I think, investments in data access and who gets to do things with the data. And there's such gatekeeping. And so that is, I think there's a role for journalists. And also, it's not just journalists, right? I mean, community leaders, faith leaders, folks need to have access to the tools to be able to tell these really important stories.
You have a question?
Yeah, and sort of a comment. I recently heard a great presentation about AI as a strategy to really probe and query these major data sets. It's being used by to probe the archives for land ownership for 40 acres and a lie. But it might be the same kind of thing that could be used in Chicago to really probe the LLC, and even the same LLC, but you're right. I mean, probably these same people own multiple LLCs for each of their slum settings. So anyway, I just wonder if AI could be used as a resource for these complex data gathering.
I was thinking about Chaya in the Child Health Opportunity Index, and thinking about building bridges too, and how you have this index and you do so much work with community organizations. How are you able to build that bridge between the data that you all have in this data set and then really helping to empower communities with that information?
Well, the short answer to that is involvement from the very beginning. We've had an existing long relationship with many of the organizations in DC, so there's a lot of trust that's been built from day one, regardless of which data set we're using. And maybe my slightly different take and answer to that question is I've been thinking a lot about, what could we do better with the data? And I'm talking mostly about quantitative data, because that is what I work with. And one of the challenges we have, and why it's important to work with community organizations, is the data often don't reflect the people. So people don't see themselves in the data. Whether I'm talking about the Child Opportunity Index or something that we should all be familiar with, the census data. Census 2020 just happened. About 5 years now, but 4 years. And we're going to see it again in 2030. And the ways we ask questions impact the responses that we get. So there are a lot of people right now good people, looking at how we collect race and ethnicity data. And it's the same concept whether we're looking at race and ethnicity or gender identity, but I'll use race and ethnicity as an example. So right now, as we stand right now, race and ethnicity are collected separately. So you are a race and then you have a separate ethnicity. I will tell you, after working in this space for, 30 years now, even I'm confused by that. I mean, I've been trained to say like, oh, I'm Asian, but my kids are Asian and white. But I'll tell you, it is confusing to me. And what happens when you have questions that don't reflect how people identify, you get misinformation or you get a lot of blank information. That's not helpful to anyone. So some of the work the Census Bureau is doing right now is looking at, how do we ask those questions better? Do we combine race and ethnicity into one question rather than two questions? Do we disaggregate some of the information? So the other example I'll give, and this pertains to some of the work we've done in DC, is how we collect information on Latina people, sometimes called Hispanic. And it's a mess. I'll just tell you, it is an absolute mess that we've kind of grouped together Hispanic and then Latina, where one's a colonizer, one's been colonized. The income differences of people that identify as Latina, or Hispanic is really, really wide, with our Colombian and Cuban Americans having way higher household income than maybe Mexican Americans. And the same thing happens, personally for me, in the Asian category. So in the Asian category, Indians are grouped with all other types of who've been called Asians, East Asian. Right. And the disparity in even just something as income, which is often a predictor of a lot of things. It's not a predictor of everything, but household income is often a predictor of many things. The disparity, I just looked it up to get the most recent numbers for you all last night. The disparity in household income between Indian Americans and Vietnamese Americans is $50,000 in disparity. That's the disparity between the groups. So when we group everyone together as if they're homogenous populations, it's really hard to make sense of that information. When John was talking about how people use the data to lie, I'm sure there are people who use the data to lie. I mean, we see it. Okay, we see it all the time. But let's just say it's not even that. Most situations, let's say it's not a conscious decision, maybe, to lie. But what I always say is nothing about data is objective. Absolutely nothing. So because I run a data lab at Children's, I have people that come to my shop all the time to say, hey, we're advocating for X or Y. Can you give me the number of children with diabetes that live in this area that had an income of X, right? And I always have a million questions because I could run that any amount of ways. And it's not that I'm lying. It's not. It's like there's so many different perspectives and ways to look at this. So that's just something to keep in mind. And that's why I think it's so important to combine the qualitative data with the quantitative data. And you're still not going to get to truth because to me, there isn't necessarily one truth. The truth is coming from who is asking the question, your perspective on the information. And sometimes I think that regardless of where you are in this space, I think we're all fairly like-minded people and we probably share the same end goals for society. I will tell you that I have great friends that would look at that question and come up with a completely different answer because their perspective is different. Exactly. It's not, I don't like to think of it as a right and wrong. I don't think we get very far if we think of it that way. But I think it's about being open-minded, listening, hearing, reconsidering how you run the data, how you interpret the data, having different types of people interpret the data with you. I think that's important.
I'm really feeling compelled to share this because it brings all three of sort of your sectors together in the story that's playing out. We have a hospital system. This is no judgment. We have a hospital system that has a hospital in a very impoverished area and a more affluent area. The monies that have been generated out of this impoverished hospital have been sent to the hospital to the point of $1 million chandelier being purchased for this hospital. When you look at this was discovered because of a journalist who did an investigative story on the community benefits of this hospital. Part of the reason these investments went there was because a developer and several developers were part of the hospital. And what they were doing was trying to skew the development in order to increase the property values of the more affluent area, right? And so But I think it's a quintessential story for me about like the importance of uncovering information that reveals injustice, right? And the accountability within these institutions to really drive resources into where there is most need, right? Because in the same area, we have a higher rate of pedestrian injury and fatality for lack of sidewalks and bike lanes, right? So it's an area where we have a higher incidence of diabetes and chronic illness because we don't have full service grocery stores. We don't have park space. We don't have all of the things that would increase the vibrancy of people who want to live there, the opportunities to have housing there, and a very inequitable years of life in this versus that. And so you're an advocate living in that area, right? And you're trying to build partnerships with groups that have resources. You're trying to call attention to the need for housing and development. And you're using the resources, the power that you have available in terms of connecting to help uncover. Then you become the target of the angst of drawing attention to. My nonprofit is going to be the plaintiff on this case that's being drawn. And so I just kind of was sitting here as I was listening to you guys, like all that story was playing out back in my head, right, about just how important it is. I'm not good at using data. That's why I'm here. Right? Like, I can tell a story that'll make you laugh, and I can tell a story that'll make you cry. Right? And it's based on lived experiences of people that I work with. But how do I incorporate data into telling that story?
I want to give Steve, Sandy, I'm going to get to you, but I want to give Patricia a moment to respond to that. I saw that was like resonating with you a little bit, and just
Yeah, I mean, I think so much of it is about like, I think folks are saying like openness, like asking questions. Don't just take what's kind of given. Following the money is huge. And just like knowing, starting to make those connections and partnerships, because like we all have different pieces of the puzzle. Like I don't think any person or organization like has everything we need to fight the forces that really have a lot of money and a lot of resources. And I think like we're learning more and more how biased data can be, kind of bringing this back to data. And that data is all around us. We can tell any story that we want with data. So I think what gets lifted up as truth is really rooted in who has access to shape and interpret data. And it's going to, again, take all of us kind of like coming together to have these different pieces that have to be rooted in community and like in individual experiences. And then like once we have something, we're like, wow, we need to figure this. Let's figure out like how do we connect with a journalist? How do we connect with an academic institution that might have like the resources to assess some of this quantitative data to give some more power behind the stories that we're hearing. But no, that definitely resonated with me quite a bit. I think the work that you're doing is incredible, and just the fact that your organization is willing to stand up and be a part of a legal complaint. Like I know my organization has been a part of a legal complaint, and like how just difficult that is to get folks on board with like taking that stand in that kind of a way, like really putting yourself out there, but also knowing like that is a long haul effort, and that's going to probably take years and years of your time. And how you keep like the people who have been impacted, how you keep folks kind of like stamina to continue on with that, and how you identify little wins along the way as you're looking for kind of that big win in that fight. So yeah, that's amazing.
I just wanted to comment on a couple of things that I've heard you guys say that, and to make some comments about what's worked on issues, particularly in the housing area. And I wanted to start off with saying, when you told us to look left and right, and what I was thinking is, it depends on what data you put forward and how you tell the story, because every time I looked left, I saw nothing. And so it's an easy way for people to collect data that won't really tell a story at all or uphold the status quo. And so one of the things that I've noticed that works very well is the academic institutions and even the community health needs assessment. It depends on who you get at the table to help inform what data you're pulling. And one of the things that we have to get around is the saying that we can't collect that, because that's the thing that would actually turn the tide. But what does work is if you partner, say, for example, adding to what you guys do. You have community development corporations that are collecting certain data. Be thoughtful about how we're collecting that data. And one of the things that we did that really moved the probably century-old problem in Cleveland as it relates to housing was we won a Build Health Challenge grant, added an equity component to the work that they didn't ask for. And, so in a polite, disruptive way, it's like you do everything that they ask, give them something a little bit extra. And that's the thing that actually, it was like pulling the right domino at the right time. And now you've got people who wouldn't do anything or couldn't, addressing the pushback from the landlords, and now actually getting some landlords helping to advocate. But you can change things just by thinking about, and this came up in the room earlier, who do you know? What power structure can you use to just slightly tip the balance to add to everything that you guys, it can change a whole community. Then $6 million were committed. A whole resource center for housing has been developed, and now the organization that was the recipient of the Build Health Challenge grant is running that resource center. Everything in terms of lead, moisture, all of those difficulties, the whole environment has changed just by adding a little bit of disruption and bringing in some different partners to connect to people who are already committed to the work. I hope that made sense, but I just want you guys to be thinking about things and who do we know, what's in our hand, and how do we connect and do things a little bit different.
I'm curious if any of you have experience doing that as well and thinking about just pushing the needle just a little bit more past what maybe was being expected or asked of you to do.
With our hotline, we were not asked at first to do like any of this demographic or collecting why are people calling. They were just said, here, answer the calls because they don't want to deal with it. But then we started actually collecting the data and all that. And it's been amazing, in some ways, just what you find. Like one of the things I think that first stunned me about the data was that it was 75% of women were calling year after year after year. So then started just really kind of seeing, well, why is that? It's just, it just made it clear that, affordable housing is really a women's issue, actually, because they're the ones that are actually make less money, have to deal with these, housing issues more and more. And it was just like, oh, it's just like these light bulbs that keep coming up and how we need to be, really, I guess, connecting. But they didn't ask us to collect the data. It's just like, well, let's start doing it, because you start noticing things and you start going, oh, well, I'm going to collect it. And so anyway, and I think that that's the other thing is we just have to always be open to keep on collecting. We start hearing changes, let's collect that data, because, it's probably, it doesn't exist. So then let's create it and make it exist so that we can make these changes.
Any other questions from, yeah. Okay. Oh, Terrence, we brought it back. Okay, go.
So thank you all panelists for this great discussion. And I want to pick up on where this conversation is going, in that data actually don't tell the story. We tell the story with data. And I would be interested in hearing more insight about how the people are telling the story. What are the techniques to use data strategically to move people, decision makers, to action, and to move the public towards understanding? I've heard, obviously, we need to do mixed methods research, like that is true. And I'm trained, as an academic researcher, so I know how to write to convince people that my data is valid. But that's not the same as how to write to convince people to make decisions. People already have a dominant narrative, right? So we're not even talking to them. We're talking to people who don't agree with what we're saying. And
Right.
we could overwhelm them with data. We could provide not the right amount of data. So one of the things I love about coding experiences is really teaching me the importance of narrative and thinking about how I tell the story in order to move people to action. And I just love to hear some of the techniques that you have found, whether it's using visuals or only focusing on one data point, or like what would you give to someone who wants to use the data in this advocacy way, but use it in a way that's strategic.
Yeah, I'm happy to go first on that. A couple comments to what you said, but also some of the earlier comments about not being good with using data. I just have to comment that the whole reason I became enamored with the data world is because I've always seen data as individual stories, and then you can shuffle those data points around and get a very different story, right? So like when people say they're not good with data, I'm like, no, if you can tell a story, I think it's a mindset that every single data point. So my very first job was working with the military healthcare system, and I say that because there were 8 million beneficiaries. It's a large data set. I was young, did not know how to do that type of work, and had to learn quick. But I quickly, as I started talking and listening to people, I was like, those are individual people that are either serving or their families. And I just realized that the story I'm going to at least start telling and then corroborate and refine is based on how I cut the data and how I shuffle the data. So it's really not that different. It doesn't conceptually than talking to individual people, right? It's just structured differently. To your question about what has worked in terms of communicating the data, I want to reiterate what you said, because I think it's such an important point that is missed. There is plenty of research to show that data will not sway people's opinions who already have an opinion. So we waste our time when we throw data at people that have a very firm opinion about whatever it is. You may have some room in the middle. People are not sure about this issue to sway them with data. But in this kind of space and the type of work we're doing, people feel pretty entrenched with what they believe. It's very rare that you get people that completely switch over. Because I saw a bar chart, and all of a sudden, that bar chart spoke to me. You don't see that, right? So I think a lot of the research and strategy now is suggesting that you really should be trying to find commonalities with people, even if it's outside of whatever area you're advocating for. And once you develop that common understanding relationship, that's where the change starts happening. What's been helpful for us in terms of communicating are maps. And it's possibly because, we're working with geospatial data. But I'll tell you, I'm surprised as to how engaged people are when you can show them maps of their community and visually see. Because people are intuitively very interested in where they live, right? They're interested in where they live, where they grew up, where they went to school. And it's just incredibly striking, I think, with the way the world is right now. It is striking to people when they see on a map how the disparity and the inequities look. They might know it intellectually, they might talk about it, but when you see that visually, it kind of pulls at people's hearts in a way that, from what I've seen at least, that the typical bar chart or circle chart or pie chart or anything like that has worked. So we get a lot of conversations going by throwing up maps of different things and having conversations. And so, what does that feel like to you? Did you know this? What's a shocking finding that you're finding here? And I'll tell you, there's almost always a real emotional reaction to it, which is odd when you think about a visualization. But that type of data visualizations work, especially because we work in a space of communicating how neighborhoods matter. And it's where you live. This isn't your fault. Where you live is going to determine a lot of what your opportunity is. So to see that visually, I think is.
Oh, go ahead, Cassie, and then
I just wanted to draw out a finer point on that, because I think specifically who is communicating the data makes it's important. One of the things that we know from news media is that it actually doesn't matter what the source is. It doesn't matter if it says it's been fact checked. In fact, a fact checking badge on a news article on Facebook means that certain folks are less likely to engage with it, right? And so it really matters who it's coming from. If it's posted by your Aunt Trish, people are going to trust Aunt Trish over a newsroom that is faceless, that is nameless. And I think the same goes for any institution, whether it's an academic institution, a municipal institution, a healthcare organization. I think who is imparting the data and the storytelling around that. Does this person look like me? Does this person live in my community? Does this person have, a shared experience or identity with me? Like, these are all important factors.
First, I wanted, did you have a question
Yes,
earlier?
I did.
Okay.
I think we've been talking about data, having it, but what are the challenges that I have? They don't want to give it. So, do you all have any suggestions on how to get the data
Well, I'll just share one. So we kind of do things, I guess, a little bit differently at CAFA, and I think it starts with like having real relationships with people. So it's not like one kind of entry point to give information. Like, here, do this survey, and like I think you were saying, like you're kind of like this faceless, like to fill this out and give me something, but there's not really anything really coming in return, and that just kind of goes off into the ether. You don't know where your information goes, and you kind of probably have a suspicion that it's used in a way that's not going to come back and benefit you. So what we do is really have lasting long-term relationships with the community members that we advocate alongside. So when we're collecting information all the time, it's not like this one touch point opportunity. It's just kind of this like constant, consistent thing in the background. And I'll give one quick example because I have another slide that I wanted to just show. So for example, we've worked with many years with housing choice voucher holders in Chicago because we're a fair housing organization, and we find that one of the most heavily kind of stigmatized and discriminated against groups in Chicago are housing choice voucher holders. And through our work with voucher holders, we've learned that some of our leaders have used their voucher to purchase a home. Did folks know that you could do that? We didn't know that either. We were like shocked by that. So this is something we learned directly from our leaders, and we realized like other voucher holders that were kind of in the room hearing this were like, wait, what? Like, you could do that? I want to do that too. Yeah. So we asked our partners, like other advocates in the space, and they're like, oh, don't really look into that program. It doesn't work. And we're like, but we're hearing like this energy around this. People want this opportunity. So we didn't listen to that. And we embarked on, several years long research project that we walked alongside with our voucher leaders. We ended up collecting additional information. We surveyed or spoke with or had focus groups with about 500 voucher holders in Cook County. And it was just having discussions. And our leaders were helping us have these discussions. So there's already trust there. There's someone who has your same experience that you have as a voucher holder. So it's not just coming from me as, an advocate who might not come from their community and certainly doesn't understand their lived realities. So we found that over 90% of the folks we spoke with wanted to be homeowners. We found that housing authorities have the power to make voucher renters, give them a path to become voucher homeowners. And if you look at just kind of like the data that's out there about the program, it looks like it's not successful. Less than 1% of vouchers are used for home ownership. So if you just kind of take that information and you stop and you say, well, that program doesn't work. But what we found is that if just 10% of voucher holders in Chicago had access to the program, over $1 billion in asset creation could be created in Chicago alone. So we've been fighting, and we are now finally getting attention from HUD. We're getting attention from the folks that we need to pay attention to this program and actually invest in the program. But it came from like that consistent relationship building and having research that's not only like informed by, but designed by the people that we're working alongside.
Really starting with that community engagement as the foundation there. Terrence first, and then I'll come over here.
So my question comes around the whole idea of the legal battle, and I think when you were talking about their kind of spoke to that. How then do we use our collective this, to make a striking blow as opposed to, and I ask this question because it seems like there's this element of fear. A lot of our programs are new, they're 2 and 3 years old and less, so they don't have the capacity to fight. really fight the fight. And so how then do we use our collective strength to actually go to battle legally, use law, and use, because they're not often, I've done this work for a long time, not just the equitable work, but community work for a long time. And it seemed like what works best for us, we went out at the civil rights, for example, was our young people and the movement that they had, because there was less on the table to lose. You know, the older people realized that, you know, hey, we out here fighting, run our mouth, we don't lose our ability to family. And so how do we take that kind of history and bring it forward? Because they're not listening to our compelling moral stories. You know, we can give them all that data that we want, but how then do we tell the story in a way that it's not just a moral story, it's a legal story, it's an ethical story, you know, it's a financial story, right? Because every time we push the financial button, we get spun around again into all this energy around, you know, moral ethics, you know, wanting to do right. It ain't gonna happen.
I'm hearing something about like framing, right? How
Mhm.
important is it, the framing in that storytelling, and giving those narratives?
From the legal, going down that legal.
I want to go to Cheryl. Teresa, did you also have a question? And then in the back. So I've got a queue up there. I want people to know I see them. And then, yep, I got you.
So so this is being recorded, so I'm going to be a little less descriptive about such circumstances, but I am really curious about the hidden data stuff that we were talking about, because to me that is that is part of why I feel like my role was created. So my background is I am a incoming VP of Culture and Belonging at a small Mennonite college in Kansas. And I'm really excited about it. But of course, there's all kinds of things that are fraught with a role like mine already. But the concerns that I have are about the retention of students of color. And because it has this legacy group, which you can kind of already figure out who that legacy group is, there are ways that those students finish in 4 years, they're retained when they're, you know, like thinking about students that transfer in that are part of that group. And then there's the students of color who are in and out, or take a long time to graduate, or fill in the blank. And so part of my role will be connected to that and creating a sense of belonging, not just for students, but for faculty and staff as well. And so I am so curious about how hidden data can be culled. And I know, because I've studied the civil rights movement as part of my background, there are ways that movement has shamed the culture into shifting. It's never because it's the right thing to do, right? So I'm hearing some things about hidden data, and that is the stuff that I'm hearing. Just the few things that I've heard have shocked me in a huge way. And I want to bring those things to the forefront to say, this is why this initiative has to happen. This is why this has to work. This is how we have to work harder at retaining students, you know, and some of the stuff that it just makes me cry. And I have a child who went to this school who did great, but he, you know, and I thought he would be sheltered because I'm there. My husband is also a professor, and we thought we could shelter him from some of the things that happen systemically to students of color. And come to find out, his experience was somewhat similar, but he made it through. But I think they make it through with the asterisk. And I want that to shift. So anyway, I know I'm.
Any responses?
I mean, I'm just very concerned about what's happening in academia. I mean, we've all read about what happened with the recent rulings and what the raises of factor or not, but it's very personal to me, maybe close to me, because I've got two daughters. One just applied to college last year, and one's applying this year. So aside from knowing about it, I went through it with her. We were doing the Common App together. And it just felt very shocking to me that the questions around race and ethnicity are no longer. I mean, they're not there. I kept looking for them because I thought it was, the way I had interpreted it was the information would still be collected, but not used in the admissions process, which I was a little like, that's interesting. Is it going to be hidden? Is it not going to be given to the reviewers? But it's at least still collected, right? So, retrospectively, you could do some analysis, see what the outcomes are. I'll tell you just firsthand from filling out the application, it wasn't collected. Like there was no race or ethnicity data that was required of any of the students. And to me, I was like, how could that possibly be? I mean,
We will collect it. We're private. So
yeah, right. So different institutions have implemented differently. On the Common App, I believe it was optional, so a lot of people left it off. And then other private universities, some it was not included at all, and some it was. So it's just all over the place. You can't have a standard set of data now to even look at. I don't have a solution. I have concern as well.
I think, you said the word system, and I think that that's really clutch, and that it feels sometimes so much easier to kind of chalk it up to a systemic failure. When one of the solutions, I think, is like picking it apart, and a system has different pieces, and there are pieces that are probably working, and there are pieces that could be working better if other pieces were in motion. And so I think part of the hard work when we're talking about challenging systems is picking the systems apart to really understand the different pieces. And so, that can really help with parsing data, with understanding what is going to be helpful, what is missing. Gosh, miss the gaps, like it's a huge part, and it's hard, and it sucks because they're designed to not be picked apart.
Right.
I was just going to say, I think at some point, and I don't know, but we need to be holding some of the individuals accountable, and that those hidden people, and I'm not quite sure how to do that, but we can say it is systemic, but there are individuals that are benefiting behind those systems, and at some point we need to be able to be starting to draw them out and start holding the individuals who are actually propping this up and are benefiting from it. So, and I wish I have no idea. I don't know anything about education, and I'm not a data expert. So, but I also think that we somehow need to be, yes, accountability has to be there. Else,
And that holds true even for work at a lower level. It could be one person in an organization that doesn't like what maybe the president has said we want to do, and without some way to hold. One time I had to just say, "Hey, we drew up MOUs," and without like saying fire this person, it's like, here's what's happening in your system, so we're not able to move forward on what your commitment was to us, because you find those individuals who are clogging up the system, even at a smaller level, like at an organizational level. But I like what you said about examining the system and seeing what parts are working and what parts aren't. And I don't have an answer for it, but I do feel like I want us to hold space for figuring out if that's a collective work, system by system, that we could do together. I love that.
All right, so we have 5 minutes. I'm going to get Teresa in the back, and then we will. Oh, yes, and Cynthia.
I just want to build off of the question. This has been a very important, very interesting panel, just about the importance of uncovering information and data that reveals injustice. I guess, what I was looking for in this conversation is, I know that the CDC has a serious threat. And so, what is the hidden data around and I don't know if anybody has indicators.
I can speak to a little bit of, where.
And Celeste, I know
Yeah.
we have a lot of resources.
No, let me step into a professional role, not Celeste role, with my own personal thoughts and beliefs.
Right.
There was a lot of movement happening with people declaring, right? And then we start to see okay, what do we do with this information? What do we do with this movement? What is the data that's helping us tell these stories? And so I know that, they were tracking what cities and what jurisdictions were declaring this crisis and starting to track what these different jurisdictions and things are doing. I think what's happening is everyone's doing something different. And so we don't have this just collective of this is what in these declarations, what we're looking for to happen, or, okay, if your city has made this declaration, these are the things that we're going to push you to do so that we can start to track how these declarations are moving and creating some kind of movement building. And so there's a lot of we're trying to tell a story, but then it's like, what do we do from there? I know the Beaumont is working a lot with that information. And so I would say maybe tap into them and see how they're helping these collectives. I think they're trying to build some kind of network with that. But I'm not quite sure there's just this, we've gotten there yet after these declarations have been.
I would just say I think we should look a bit at the reparations movement and all that, because I really think that there are corporations and people that have hugely benefited, and they have not been held accountable yet, and they need to be held accountable. So I would look at some of the research that they're doing and some of the information that they're gathering. I think that could help point us in some sort of direction.
That's very helpful information.
Hey guys, my research tends to focus on intersection collaboration, so I kind of touch all of these areas. But I wanted to answer a couple of the questions and just throw out some resources. So somebody asked a question about how do you use the data, and I think the journalist spoke. So she spoke to if Patricia is the one who's giving that information, it makes a difference, and it's really true. But I think remembering intersectional collaboration as just like a foundation and not using it just one time, but always is really important. Like everybody here has used collaboration in their storytelling, but now just to tell us what they did, but they didn't call it that. But that's the real resource, right? It's like the journalist is using intersection collaboration all the time. Like she's the mouthpiece. Her team is able to do that for whoever's giving her the data. They might not have the platform to do whatever it is that they need to do, but they do have the information that only can be shared via lived experience. And here's the gentleman with the phone calls, right? Like that's collaboration. Somebody gave them a job that they didn't want to take on, but they did it, right? And he had the passion. His team was like, let's take some members. Like there's a skill set, there's a resource that you have individually that's very unique to you. And so I think just keeping that in mind is really important. Having a very specific ask also is really helpful. So if Trish reposts something on LinkedIn, but there's an ask for an organizational level, there's an ask for an individual level, there's an ask for a city level, like being very clear about what you want people to do with the data that they've given. So I'm treasurer, and I want so and so to repost this so that 5 people can see it. That's a real easy ask for a student, right? But if you're a city or if you have an income over this, I would like for you to share this with 10 leaders who have decision-making power. Like that's another easy ask for that person. So just being really specific about your plan, and sometimes that takes a good month of time before you decide to press send to everybody, but that's really, really helpful. I mean, I think sometimes we forget about it, and therefore we've lost the ability to use that data up front. We've messed up what we already got, right? And then just lastly, effective communication and relationship and trust building are really, really, really important. You guys all touched on that too. But again, how do you maintain the collaborative energy? Yeah, like we're all part of this entity here. We might be talking in 20 years because we came to this
right? But like being really intentional about that is important because you never know when I'm gonna need to call you out. Be like, hey girl, I remember that conversation you had in the spring. But like just remembering opportunities and not being transactional, like I'm not saying like always think of using somebody. That's not the case. But just being aware of that, making those connections, and being creative. So I just wanted to show you guys how you're overseeing some of the key elements, and it's just connecting dots. That's really going to allow people to use the data in the way that even not hidden data. Again, if you tell somebody, hey, I like data, just in a random conversation, it's like, what is data? Like, talk to them about what that looks like. And like you said, children's hospital, people don't even realize that their everyday conversations or gossip is data. Like, that is it. So if they're recognizing, oh, I'm fluent in this, I know this about housing, let me tell you all of my data, and now you have to take the notes. You know something that nobody else knows. Just being aware of how easy it is to gather.
All right, Miss Cynthia, take us home.
All right. Actually, a treasure from the researcher academic background. I'm a lawyer by training, a civil rights lawyer. And so to Terrence's question, I really, I too, I embrace all of you all. It was such a phenomenal, they're going to hear, they're going to hear about this. But one of the things that I think is important as far as who is saying it, is that sometimes it's very effective to have an uncommon ally or somebody, an unexpected purveyor of the information. So if you can get the Republican to talk about the thing that's commonly thought of as Democrat or the rich person about things that people think they wouldn't be interested in, it can often be a very powerful, it's sort of like on Trish, a powerful purveyor of data. And on the media, on the advocacy, so I've done large-scale public interest litigation, and it takes forever. And so sometimes you can short circuit or jumpstart the process. In my experience, I in fact presented a whole paper at an international legal conference attended by Nelson Mandela about media advocacy. And just a very quick story. I was working in response to the civil unrest in 1992 when Rodney King was beaten and the police officers were acquitted and LA went up in flames. And shortly thereafter, I was thrust into this job. I didn't even know what FEMA was. The Federal Emergency Management Agency had reams and reams of regulations, which I quickly learned, and then realized that they were totally concerned about not having their money go to people who were poor before the unrest. They only wanted it to go to people who lost things because of the unrest. But if you were poor before it, you had no safety net. And so we were working, and our people were about to be evicted. And it was a Friday. I had connections with the media, and I called the family and I said, are you willing to talk to the press? And I actually was going out of town for the first time in months to a wedding. When I got back on Monday morning, their story was on the front page of the LA Times, and those people were not evicted as they were on the brink of eviction because I had run out of all of my sort of legal strategies. So I think that media advocacy, armed with some data, and finally about this issue of, well, people don't want to tell me. You know, these are families' personal information. They don't want to offer it because they're scared.
Yes.
But if you have a feedback loop and people, a trusted relationship and a feedback loop, so people understand what are you going to do with these numbers?
Yeah.
What are you going to do with my information? And then they hear. We talked to 200 families, and this is what we found was a common pattern. Then people are like, well, here's my story. So I think that it's very important to have a feedback loop as we're collecting data so people understand how they fit into the picture and what are you doing with the data. And so then it comes back to them. So those are just some of the things.
Thank you. I appreciate it.
Thank you.
Thank you. I want to give our panelists an opportunity. And one closing word in the words of Treasure on what's the ask to you all. What's your charge? And what's the charge that you want to give everyone in one word as they are approaching thinking about data and data advocacy.
Okay, well, trust building.
Engagement.
Collaboration.
Questioning.
Thank you all.
Thank
All right.
you.
Appreciate it. Thank
All
you all.
of those words are relational.
Yes,
They are.
absolutely. Lunch.